Welcome to Modern Management of the Older Adult, brought to you by the Institute of Clinical Excellence. What's up, team? Dustin Jones here. You are listening to the PT on Ice Daily Show, brought to you by the Institute of Clinical Excellence. Today, we're talking about osteoporosis, diagnosis, prognosis, and treatment. This is a big topic that so many of the folks, the older adults that we work with, they will receive this diagnosis or have this discussed with them. And a lot of times it's not given a lot of context, or they don't have full understanding of what this really means for them and what they can do about it. Most importantly, what they can do about it. All right, so let's get into this. We'll start with the diagnosis piece, just really defining what is osteoporosis, and then spend a little bit more time on the prognosis side of things and the treatment, because I feel like that's where we have a lot of opportunity to really serve our folks well. So osteoporosis, if we're going to, review, go all the way back to your formal training when you learn some of these numbers that you may have forgotten. All right. So when that conversation of bone mineral density starts to come into play, usually it's for postmenopausal women, or males over 50 years old, start to look at bone mineral density. And the way that we can objectively measure bone mineral density is through a DEXA scan. You'll see that DXA or DEXA, that's dual energy X-ray absorptiometry, or DEXA is the reason why everyone calls it that. So you're basically looking at bone mineral density, and if for individuals that are over, that kind of 65-year range, you're going to get a score. That score is going to be a T-score. And so we're taking the measurement of the minerals in the bone in a certain area and comparing that to same sex and race norms for a younger population. So we're comparing it to a younger cohort, and that's where you'll get those T-scores. And so based on those T-scores, you will get maybe something from 0 to -1, and that is considered to be normal and healthy. Then that -1 to -2.5 is that osteopenic range, or osteopenia, which means the bones are a little bit weaker, but not full-blown osteoporosis just yet. And then below -2.5 and below, they will receive that osteoporosis diagnosis. Typically, along with the DEXA scan, a physician is doing a FRAX screen. This measures the 10-year risk of having a fracture. There's some different lifestyle questions, and it'll basically spit out a percentage of likelihood that individual is going to have a fracture within the next 10 years. And so those two pieces of information really formulate someone giving a diagnosis, but then also the treatment that follows. And then based on those T-score readings, and as well as the FRAX score, the pathways are typically, there's going to be some pharmacology involved, right? Whether we're preventing bone resorption or we're really encouraging more bone formation and remodeling. And then they're typically going to give some blanket generic recommendation of exercise, of weight-bearing exercise. All right. Now, the tough part about this diagnosis is it can come from a whole host of different providers. So you can see primary care physicians, kind of leading the charge of looking into bone mineral density. Internists can as well. Orthopedic physicians can as well. And so there will be different doctors that will be kind of looking into bone mineral density. And then they will often refer out to someone like an endocrinologist, for example, for further treatment. And so there's a lot of people kind of involved talking about this. And what at least I have seen is that this has been a topic that has been brought up, and a lot of fear has been revolving around this topic, but not a ton of guidance of what it really means day to day to really influence bone mineral density beyond taking that pill and, quote unquote, weight bearing activities. I've just worked with so many people that did not understand that diagnosis and what it actually meant. All right. So just understand that. I'm not saying that always happens, but in a lot of the folks that I work with, that is typically the case. So they're given this diagnosis, and now let's talk about the prognosis. And in particular, what I want to speak to is the opportunity to really dive into the DEXA scan that our patients received. And I'm not saying it is our place to kind of give a medical prognosis per se. Well, I guess when I'm saying prognosis is what can they expect going forward and to give them context of that diagnosis. So I'm mainly work in the context of fitness now at Stronger Life in Lexington, Kentucky, and it's a gym for folks only over 55. And we're about 4 years old now. And so over the past, 4 years, we've had a lot of members that have had at least, a couple DEXA scans at this point. And so I put a field out for folks to send me some of their DEXA scans. And this is something that these are conversations I'll typically have with folks anyway once they get their DEXA scan. But this is something I want you all to do. I want you to ask some of your folks that have osteoporosis on their, their chart, their diagnosis list. Say, hey, can I see your DEXA scan? Or, if you're in a medical system, look up their DEXA scan because it's really interesting. And you start to look at a lot of these reports and you'll have some of them that are more kind of narrative based, that, are basically just several paragraphs kind of outlining, what to expect, what they found, something more along the lines of a bunch of words. If you're not watching, I'm just holding up some of these DEXA scans, but more narrative. But then a lot of them will actually have graphs of T-scores when they had that DEXA scan and where. So the most common areas are going to be the lumbar spine, the neck of both femurs, bilateral femurs, and then they'll kind of zoom out a little bit and look at the total hip as well. And so get those DEXA scans and look at some of those numbers. And when you start to look, what you're often going to find is variation amongst the different sites. So you can have individuals that may have that below negative 2.5 or below, let's say at the neck of the left femur, for example. And then the neck of the right femur may be negative 1.7, osteopenic. The lumbar spine may be negative 1.5, for example, osteopenic. And so technically that person has osteoporosis on the left side, right? The right and the lumbar spine does not have osteoporosis, osteopenic, still a concern, right? But not as bad as that left side. That message is often missed by many of our patients. Now, I believe they're getting that message, when they are getting these reports and having conversations with some of the physicians, but they're probably getting all kinds of recommendations. They're getting that diagnosis and all kinds of things that, we may only hear half of what is actually being said. But a lot of folks that I work with, they will receive that diagnosis of osteoporosis that in reality is only in their lumbar spine, for example. And they will take that and own it as if every single bone in their body is brittle and about to combust under any type of pressure or load. They embrace that diagnosis it's this global systemic, osteoporosis. Every single bone I have is tremendously weak without acknowledging that there's some variability in different areas of the body. That piece of information for folks can be really eye-opening and very empowering. Oh my gosh, are you saying that I only really have this in this particular area of my body and not everywhere else? That's a sense of relief for a lot of folks. A lot of folks will take this diagnosis and view it as almost like a death sentence. Everything, I am so weak, I'm so fragile, I need to be very careful or I'm going to break something, any bone, I need to be very, very concerned about, right? And that's not necessarily what's happening. It's usually in kind of one, maybe two areas that are a concern, particularly folks that are initially receiving these DEXA scans. And the cool thing about where I'm at now, working with folks for over 4 years, like this individual, she's had a DEXA scan every 2 years. She was on a negative slope, -3 in 2017, -3.1 in 2019, -3.4 in 2022. And her most recent scan a couple months ago was -2.8. This is at her lumbar spine. And when you are able to give context to the diagnosis, but then also be able to see over time, you'll be able to spot trends and then hopefully be able to potentially reverse trends or slow down trends. And we're seeing this at Stronger Life. And I know many of y'all don't have the luxury of working with folks consistently, 3 times a week over the course of several years. But man, if we can apply some of the interventions I'm going to talk about here in a second over the course of years, you can have a significant influence in a lot of these DEXA scan readings. And we're definitely seeing that. And you can too. But I think that conversation, the prognosis, them understanding the diagnosis, where in particular that may be, that they understand, every single bone in my body is not going to combust under pressure. This particular area may be more concerned, but I'm doing okay in these other areas. It's really good for them to hear that, and that can be a more empowering message. Now, the most important thing, I think, is that we take the information from this DEXA scan and then we use it in our plans of care. And so if I have someone that has maybe normal osteopenic in terms of the DEXA scan in their bilateral femurs, neck of their femurs, but then they're kind of borderline osteoporosis in their lumbar spine, for example. As a physical therapist, that gives me something that I can focus on, that I can give targeted interventions to give specific forces and stressors to that area in a very progressive manner, keep in mind, to stimulate a change in that bone mineral density or increase the odds that we can see change in their bone mineral density. So we take that information, use it for our plan of care. Some folks, you may be focused, all right, this left hip, let's load up this left hip a little bit more, do some unilateral stuff, staggered stance type things, not neglecting the other side per se, but if there's a big difference, we may want to give preference to one side or the other. If it's a spine, lots of loaded carries, deadlifts, those types of things where we're getting that axial compression, getting those forces through the spine. We can give targeted interventions that's going to encourage those bones to remodel, to get stronger, or potentially slow down, decline. So we take that information and take it into our intervention piece. Now from the intervention piece, this is a 15, 20 minute podcast. We have a whole week on this in our MOA level 2 course. But what you need to know is there are 3 things that are really, really important if osteoporosis is on board. One is balance training. This doesn't directly impact bone mineral density, but if we're able to improve people's balance capacity, I would even go as far to say their fall capacity as well. Do they know how to land? Do they have the balance capacity to even prevent the fall? That whole conversation of falls prevention and falls preparedness that we speak to, particularly in our live course, is really helpful for these individuals. Because if we can prevent a fall or even teach people how to fall in a more efficient or safer manner, you could potentially prevent an injurious fall or an osteoporotic related fracture. So that's the first thing. Second thing is progressive resistance training. Bones really like progressive resistance training, where we're working up to relatively higher percentages of a 1 rep max, 70, 80, 85%. We're not going to come out the gate hitting that, but it'll take some time. But there's some really promising studies showing that, man, if people are able to regularly train at those higher intensities, they get really strong. They improve in a lot of the functional outcome measures that we care a lot about, but also their bone mineral density as well. Liftmore trial is a great example of one group that's been able to show that. And then probably one of the more neglected things that we can definitely implement that can be intimidating for a lot of folks, but I've found a lot very empowering for patients once they're able to do these things, and that is impact training, weight bearing as well, of loading the bones, but really thinking about the rate of loading. Progressive resistance training puts a ton of force, a bunch of load through that skeletal system that gets really good results. But bone can also respond really well to rapid loading. So think like plyometrics, stomping, heel stomps, step ups, maybe a plyometric push up, for example, or a quick, bearing of weight through the upper extremities, something along those lines where we're getting those increased ground reaction forces, we're getting those impact that can give the bones a signal to remodel. You take balance training, you take falls preparedness, sprinkle in some progressive resistance training, and then sprinkle in some of that impact training, and you stretch that out over years. And I will put my money that you're going to see some solid results when your patient comes back and says, oh my gosh, Alan, look at my DEXA scan I just got. Remember the previous year, about a couple years ago, is like right when we started working together. And then, man, I just had this DEXA scan and I've reversed my osteoporosis. We've seen that. Not to say it's going to happen every time, but people have the capacity to change, and we often don't perceive that with this particular diagnosis. It is not a death sentence. There's a lot we can do. So understand the diagnosis, but then also understand that prognosis and give your patients context. get that DEXA scan, look at it, analyze it. It's going to give you a lot of helpful information that they may not have comprehended. And it can ease their mind of a lot of concern and worry, but it can also give them something that they know they can do. And we can take that information and give a targeted intervention to a particular area that may be more troublesome than others. But man, if we combine that balance training, falls preparedness, progressive resistance training, and impact training with folks over a long duration of time, we can see some really significant results. All right, y'all. I appreciate y'all taking the time to listen. Let me know if you have any thoughts, questions, or your experiences working with folks. I do want to make sure I'm not saying everyone's going to get better. Everyone's going to improve their bone mineral density. That is not the case. But man, if we can try without causing more harm, I think that's a good thing to pursue. And oftentimes we can see some improvement in folks. Before I go, I do want to mention our MMOA courses. I already mentioned that level 2 where we talk a lot about osteoporosis. Our online level 1 course is starting May 15th. Our level 2 course is starting May 16th. These are both 8 weeks long, about 2 hours a week. So you'll get 16 CEUs for PT, OT. And we equip you all to be the go-to clinician to best serve older adults in your community. That's likely going to make you a very, very busy clinician serving these folks. And then our live course, we're going to be in Bismarck, North Dakota, and Richmond, Virginia on May 18th and 19th. I'm going to be in Scottsdale, Arizona, the beginning of June 1st and 2nd. And then we'll be in Spring, Texas, June 8th and 9th. We'd love to see y'all on the road or see y'all online. You have a lovely rest of your Wednesday and go check out those DEXA scans. See y'all. Thank you for listening to the MMOA podcast. If you found this helpful, please share with someone that could benefit. And if you're looking for more practical content to help you better serve older adults, head over to www.mmoa.online, where you can learn more about our free resources, our community, continuing education courses, and our certification. Once again, that's www.mmoa.online. Thanks for listening.